questions. So I'd like to introduce our next speaker, Dr. Matthew Neal. He's visiting us from the Mayo Clinic campus in Arizona, here to talk about the robotics and minimally invasive spine surgery.
Okay, thank you very much. Dr. Chen did a nice introduction to robotics in his opening presentation. So we're talking about the state of robotics and minimally invasive spine surgery. All right, so no relevant disclosures. So robotic assistance has been used in several surgical subspecialties, but robotics in spine surgery is relatively new. We've seen advancement in several areas with our minimally invasive spine surgery techniques, with our robotic technology, and with our imaging capabilities that together have allowed for the possibility of image-guided robotic minimally invasive surgery. So let's take a look at these. We've seen great evolution in our spine imaging modalities. Back in the 1890s, X-ray was introduced. Back then it took 15 minutes to get an X-ray. There was a tremendous amount of radiation used, and we got modest quality images. And over the past century, we've seen fluoroscopy, CAT scans, MRIs all become widely accessible. And in the 1990s, the navigation concept was introduced. And modern neuronavigation refers to a computer-based system that allows us to track our instruments live during surgery. Neuronavigation is considered an evolutionary step for stereotaxis. Stereotaxis has been defined as the neurosurgical method using the Cartesian coordinate system to locate points within the brain using external cranial landmarks. This term was coined by Victor Horsley and Robert Clark in 1908. They were using a frame-based system to do research in monkeys and very precisely place leads in the cerebellar nuclei. And David Roberts and Jean Barnett have also been credited for advancing the field of stereotaxis. So in the late 1990s, fluoroscopic imaging-based navigation became available. There were some limitations, there was some image distortion, there was a lot of radiation used, and we lacked axial images. And shortly thereafter, intraoperative mobile CT scanners got introduced, and these early systems had some workflow issues. There was a closed bore, so it was a closed gantry, so it was difficult to get around the patient, and a small bore size. In 2006, the O-arm intraoperative CT scanner got introduced and has become widely popular because of the breakable gantry that opens and closes around the patient. There's fast auto-registration, and we get high-quality bony images. There are other intraoperative CT scan